Hi folks, last week I did a reel on what to expect before colonoscopy, so I thought I'd do one on what to expect after. Here are some high points. Depending on the type of sedation you receive, you might feel groggy afterwards for the rest of the day. Regardless of the type though, most people are back to normal by the next day. You might feel bloated for a few hours after your colonoscopy, depending on what was used to open up or inflate your colon. In my practice, what we use causes minimal to no bloating, so this is usually a non-issue. Driving. You should be able to go back to driving the next day after your procedure, but not the day of if you received sedation. You generally need to have someone you know drive you home, so calling a random Uber is typically not permitted for safety reasons. If biopsies were taken or polyps were removed, depending on their location, size, and number, you might see a small amount of blood in your stool for a day or so. A large amount of blood from below is pretty much never normal. Eating. I usually say see what you're in the mood for and go from there. Some patients are able to go out and have a hamburger or pizza, but this may not sit well with everyone's stomach. But again, almost everyone is back to eating normally by the next day. There's a lot more detail I could go into, but I'll pause here and let me know in the comments if any questions.